Good morning. I would like to share some experiences we've had. We have a number of initiatives at Nemours Health Prevention Services where we interface with various sectors. And the one I'm going to talk about is our interface with schools. I'm going to use 3 examples of that. We started doing this work as a result of the USDA regulation for mandating school wellness policy and school wellness councils. And that took effect in 2006. We saw that as an opportunity to work with school districts to change the way they look at students and to start to impact that and help them move to thinking more about students' health instead of just students' academic performance. You're probably aware that with all the focus on testing and public education today, some of the things that educators used to think about and used to be part of their daily routine have slipped off the plate. So they're very, very busy people today, and they're under tremendous stress today to accomplish, to have students achieve high scores. So when we started this work, it became clear that we had to do something. We had to have a way to speak their language. We had to start moving them towards thinking about children's health again. So the first initiative I want to talk about is called Make School a Moving Experience. Okay. Not that one. That one. Okay. So Make School a Moving Experience is the program that we initiated in 2010. After working with school districts for several years on wellness policy, our school district leaders were telling us that they could figure out how to change the food policy within schools, but they could not quite figure out how to change the physical activity patterns that children had in school. They saw that as something important, but something beyond their capacity to do, given their other requirements. So we identified some schools that were doing some work around this. We developed some exemplars, and then we went back and we started working with school districts in a very real way. We did this. We applied for and received Carol M. White PEP grant from the U.S. Department of Education that funded that. It was a tremendous opportunity. It really worked well for us. So we recruited school districts and schools. We worked with them, helped them develop individual plans that they owned. And in those plans, we suggested some evidence-based practice that they could implement. And it's not like we had a whole plethora of them. We were working with Catch, which is out of the University of Texas. We were working with Take 10, which is out of Georgia. And then we were working with just the idea of making sure recess happened for all kids and using an early exercise period, the opening day of the school. 4 different things, but every school that we worked with used that same formula of 4 things, but they owned it because they decided how much time for each, what's the focus on it, how we're going to make it happen for us. That proved to be very, very important, and it's something I want to come back to later. So we focused on the combination of classroom physical activity, physical education, recess, and other kinds of things, opportunities like before school or early school activities. Okay. There. So in the blue, you'll see the things that the schools did. In the green, you'll see the things that Nemours did to help support that. So what we did is we tried to provide a supportive atmosphere and give technical assistance to schools to make these changes. Okay, so our technical assistance was around Catch, Take 10, and Catch Kids Club, which is an after-school program. We did a lot of professional development. Delaware is a small state, but in the small state of Delaware, we trained over 2,000 teachers in the use of Take 10. We trained physical educators and cafeteria workers in the use of Catch, and we helped schools understand why this is important. What happened as a result? So we had partnerships with, there are 19 school districts in Delaware. We were working with 13. Of the 19, only 15 of them have elementary grades, and this was an elementary initiative. So we were working with 13 of the 15 districts that had that. In all, we worked with 74 public elementary schools. We reached 40,000 students, 2,000 teachers. What was the actual change in student behavior? We went from a situation where students, before we had the initiative, were getting less than 100 minutes a week of physical activity to a situation where students were getting on average around 200 minutes of physical activity, and about 138 of those minutes were moderate to vigorous. We didn't reach our 150 moderate to vigorous goal that we tried, but we made great strides. The next one program I want to talk about is Community Transformation Grant. That was a CDC grant that we received in 2012. It's a 2-year grant. We're ready to close that down soon. And in that grant, we had focused on physical activity, active living, nutrition, and behavioral health. We thought it was real important that we focus on behavioral health because school people for years, when we started working with them on PA and other things, they kept coming back to us saying, that's fine, we understand it's important, but help us with our kids because they're not doing well. They're coming to us with many challenges. So we started doing some of that work, and that work really focused around just helping them coordinate the resources they had because they were patchwork together over years and they weren't well coordinated. So we had schools, we worked with schools and we helped school leaders use WellSat, the Yale Rudd tool, to help them evaluate their wellness policy and help them become connoisseurs of wellness policy. We helped schools go through health index from CDC and help school leaders understand the kinds of things that they probably should be doing and open their eyes what the opportunities are for health and the like. And we helped our nutrition people to make the food more attractive, make it use behavioral economics so that kids would actually eat the food that's on the plate. I'll speed through some of these. The result of all that is that by working in that way, when we leave on September 29th, 2014, when that grant ends, we have a population of school leaders who understand wellness policy, who see the benefits of it and understand what it should look like. We have a group of school leaders who also are committed to implementing those things. Move on to my last. That's student health collaboration. I'll go through that quickly. That grew out of the other connections we had with schools, and school nurses were coming to us and saying, we can't get access to your records. We can't get access to the information we need to treat your patients, our students. We created a system using a web-based application for our electronic medical records, and we have contracts with schools. We see school districts as the same as a medical practice, and we see the individual nurses the same as practitioners within that practice. We have them sign contracts, we train them, and with parent authorization, nurses can gain access to our electronic medical records for that student. Move forward quickly to some of the. So you see, we are working with 100% of the school districts. We're working with 64 charter schools, 24 Delaware private schools. We have a lot of private schools in Delaware, and we're working with parochials as well. We're asking nurses to target just those students of medical need, so that we don't get bogged down with kids that you very seldom have a need to look up a record. And so nurses reported that they're making better use of their time. They're actually being nurses instead of clerks looking for the information. They're able to treat students. They've identified we have a ton of stories from nurses how this has made a difference in a child's health and life sometimes because they had information at their fingertips. All this was done because we worked with our partners, we respected our partners, and they allowed us to work with them in that way because we worked collaboratively with them. Thank you.
Okay, so one earlier slide we had somehow showed some sort of correlation with better education, therefore attending meetings, and there was some implication that attending meetings was positive for your health. But we also know that we have been sitting now for the last 2.5 hours, and there's a lot of evidence saying that if we sit for this long without being active, we have shortened our lives. So perhaps there's a research question there. So therefore, we are now taking a 15-minute break, really a 15-minute break. So we come back at 10:45 on that clock, which I think is a little bit slow, but we're going to go by that clock so that we can stay on schedule and have plenty of time for discussion, because I know I'm only going to ask one, but I have lots of questions from this panel that this panel has generated, and I'm sure you will as well. So you have time to think about which of the 10 questions you have, what one you want to ask during the break, and you get to move around. We'll be back in 15 minutes.